When Thomas Kinney walks through Duke Children's Hospital, he is afforded the respect of medical royalty. The mild-mannered Associate Chair of the Duke Department of Pediatrics is an internationally known visionary on sickle cell disease, a life-shortening inherited blood disorder that can cause severe pain and fatal damage to vital organs. His research, advocacy, and care of patients with the disease have led to thousands of saved and prolonged lives of children and adults. Once, the life expectancy of sufferers was just 5 years. Today, many patients live into their 50s, thanks to his work. At Duke, he has had a dramatic impact. He was a key leader in the building of the McGovern-Davidson Children's Health Center that opened in the year 2000. And Dr. Kinney pioneered a new concept for summer camps for children with a variety of chronic conditions. Duke's Camp Kaleidoscope is a national model for summer camps for sick children.
I was drawn to the care of children because of their innocence and their warmth, their trust, and it's an honor and a privilege to care for them.
Tom is a very warm, unassuming person who gets things organized very effectively and gets people to cooperate and participate.
Dr. Kinney's Duke roots run deep. He earned both undergraduate and medical degrees at Duke, performed an internship here, and after residency training in Philadelphia, he joined the Duke faculty in 1978. But his ties to Duke began long before he stepped on campus as a student. His father, Thomas D. Kinney, was chairman of the Duke Department of Pathology from 1960 to 75 and director of medical education.
I never received special treatment, and I was always grateful for that.
What grade did you get in his class?
I got an excellent.
Of course you did.
Of course.
In addition to his father, Dr. Kinney cites several others as having a profound impact on his medical education. Chair of Medicine Eugene Stead, Chair of Pediatrics Samuel Katz, and adult hematologist Wendell Ross.
I think it was their commitment to medicine and thinking about how to provide not just a medicine, but sort of a holistic approach to their illness.
Dr. Kinney had hoped to stay at Duke for his residency training, but was urged by Dr. Katz to go to the Children's Hospital of Philadelphia.
He said it was much better that I go away, and he much hoped that I would come back when I finished my training.
6 years later, that's exactly what happened when he got a call from John Folletta, the chief of Duke's Division of Pediatric Hematology, who was looking for a partner to help run the division.
John Folletta picked up the phone, and I said, "When can I start?"
Dr. Kinney's impact on Duke was immediate. In the 1980s and 90s, he was vice chairman for 10 years, then chairman for 10 years of the National Institutes of Health 20-year cooperative study of sickle cell disease.
That better understanding of the natural history study has been important as we evaluate new therapies.
One of the major protocols he championed in the late 1990s was the then controversial use of the chemotherapy drug hydroxyurea to treat sickle cell disease in children.
There was tremendous skepticism that we could be giving an neoplastic agent to a small child. How dare we? That set the stage for current trials that have now making hydroxyurea pretty much standard of care.
In the late 1980s, Dr. Kinney single-handedly pushed for and got North Carolina's statewide screening of newborns for sickle cell disease, and then was asked to chair the federal panel to write the national guidelines for sickle cell screening. He takes great pride in his effort to help make the current McGovern-Davidson Children's Health Center possible.
Because prior to the appearance of this building on the Duke campus, there was no physical beacon, lighthouse, that pointed to where a child would get his care or her care at Duke.
Tom was instrumental in getting that organized, in convincing the people responsible to put up the funding and to get it functioning.
In 1993, he was honored with a Leadership Award from the National Institutes of Health's National Heart, Lung, and Blood Institute. He also was honored by the state of North Carolina for his sickle cell advocacy. Especially meaningful to Dr. Kinney was being named the Wilbert C. Davison Distinguished Professor of Pediatrics at Duke. And then there's Camp Kaleidoscope. His visionary approach to summer camps for children with chronic illness takes place every summer at the Carolina Pines Girl Scout facility on Carr Lake. Unlike other camps, Camp Kaleidoscope integrates its Duke patients with healthy children, giving them a much-needed slice of normalcy in their lives.
Until today, most of these children have never been away for home for an overnight. That experience for the child to learn to swim, to catch a fish, to do a craft, makes you feel pretty good.
Dr. Kinney and his wife Brenda have been married 43 years. They have 2 children who both live in New Orleans. And despite his mild-mannered demeanor, Dr. Kinney has a couple of ostensibly wilder hobbies: playing poker and driving his vintage 1966 Mustang.
I've had to do some work on it through the years, but you know, all of us as we mature need to have our parts changed out. Car's no different.